So what I'm going to talk about is we had Dr. Abram give us a nice overview of epilepsy, and Dr. Sheff talked with us about some of the transitions actually in the condition of epilepsy. And I'm actually going to talk about the nuts and bolts of transition. What is it, and how do we do it? So I think it's important for us to, one, start with a definition so we all are aware of what we're talking about. And transition is defined as a purposeful, planned process that addresses the medical, psychosocial, educational, vocational needs of adolescents and young adults with chronic physical and medical conditions as they move from child-centered to adult-oriented care systems. Now, there are a couple of things that are really important to consider in this definition. The first few lines says a purposeful, planned process. So transition it's not an event. It's not, sometimes I'll see an adolescent and they're 17 years old and all of a sudden they'll come in and for some reason it will just occur to me, oh, you're 17. You know, at Nemours we only see up to 18, so we're going to have to start to figure out what to do. That's an event, not a process, not the way you want to handle it. So it's not solely also determined by chronological age. A lot of individuals with epilepsy have developmental or intellectual delay, so we also want to make sure that we are aware of their developmental age in addition to their chronological age, and that's actually what will drive the decisions that we make. And we also want to have some flexibility. We're going to talk about the stages in a few minutes, and we need to be able, sometimes we have to go back to an earlier stage, or maybe we'll skip certain parts, so we have to be flexible in our approach as well. Usually it's a multidisciplinary team. We may have a social worker, a psychologist, a neurologist, a number of people that will assist you going through the transition process. And the process is one that's collaborative. It should be one that involves the adolescent, the patient, or the adolescent, the parent, and the healthcare provider. Now that sounds like that's a pretty obvious thing. However, there have been numerous studies, including one that was conducted in 2002, in which 40% of young people reported that they had minimal to no involvement in the planning process. So this lets us know that we have a long way to go to make this a collaborative and successful process for all involved. Now, preparation should span years with a gradual expectation that the child and or adolescent take on increasing responsibility and expanding knowledge base. So we can start developing independence in very young children. In fact, 3 to 5-year-olds can start to develop independence and competence. We can have them help with daily chores, have them have daily responsibility, maybe help clean up their room, help you sort laundry, help with pet care, just something that they can do to help them to become more independent. And as they get a little bit older, when they're 6 to 11 years, we want them to be involved in responsibility for self-care, now really responsible for cleaning their room and things of that nature. And by doing this, we allow the child to develop confidence and a sense of capability. So they feel that I am capable and competent and able to accomplish things. Which is very important because what we want to do is we want to lay the foundation. As I said earlier, transition is a process. In order for us to go through the process, we need to have a solid foundation. And we certainly can't start developing that foundation at 14. Now, before we go through what's involved in the process, I think it's important to talk about perception, because perception can be reality, because that's what we think. Well, actually, sometimes perception is not reality. We know that because we used to think the world was flat, for example, and it actually is not. We know that both parents and adolescents have differences in how they view pediatric versus adult care. Both parents and adolescents tend to see adult care as not really fun, boring. So some of the things they'll say when they're asked, well, what do you think about the transition and going on into an adult facility? They'll say things like, well, there are no books, no toys, no TV, no listening to music, no joking around, not anything. So that sounds pretty dreadful, doesn't it? But that's what they think, because that is a huge contrast with a children's facility. The parent, on the other hand, says things like, I don't think there will be as much care, personal and physically, towards them, and the parents will have less say. Care will be different. So this perception will have an impact on how smooth the transition goes, because it sounds like they're sort of dreading the transition. And that, in fact, is not the case. And what we need to do is, as providers, we need to make sure and educate both the parents and adolescents about what actually happens in an adult facility. And when at all possible, we should allow the adolescent to have an opportunity to visit the facility, visit the practitioners before they transition, so they can see that these are not, really scary, mean, serious people all of the time. And also involved in perception, there actually happens to be a difference between what the adolescent thinks of transition versus what the parent thinks of transition. Now, typical of the developmental age of an adolescent is they are usually like, it's no big deal, I really don't care. Apathy, lack of concern tends to be the overwhelming theme when the adolescent is asked, what do you think about moving on to another facility? Some of the comments they make are things like, they're a hospital too, so they probably know what they're doing. So I'm really not worried. Others take a wait and see approach, and one comment that highlights that is, I need to get used to it. I've known my doctor awfully long, for 18 years, but I'll just see what's going on. I'll just see what's going to happen. Actually, I'm getting too old now for the children's hospital. Seems to be the right age for transfer, because I'm an adult now, aren't I? And this is from a 19-year-old male diagnosed with cystic fibrosis. Now we're going to contrast this with what the parents perceive and how they feel about transition. Parents, on the other hand, tend to be more worried and anxious. They make comments such as, I'm sick and anxious about the different levels of care and understanding of my child. I don't want to leave the trusted environment where everything is familiar and where you are in charge. Still, raising kids implies that you have to let them go and accept that they make their own choices. I don't like it that he had to go, but I saw the necessity, and now I see that it's good. Also, another important issue in transitions would be the shifting roles. So the responsibility shifts from the parent to the adolescent. And before we go on with this, I can just tell you that it's very difficult for a parent to step backward and encourage independence. It can be a challenge for them. And I could tell you myself what that experience was like for me actually quite recently, and I'm well over 18, as I'm sure you can guess. My mother came to visit me about a month or so ago, and there was a situation, I guess I shall say, and she decided that she was going to handle the situation without consulting me. So afterward, I said, Mom, I can't believe you did that. That was so inappropriate. You were way out of line. So then she says to me, well, I carried you for 9 months, and I love you very much, and I will always protect you. My response was, really, Mom? You're going back to my prenatal development? Come on. So that sort of shows the dynamic between the parent and the child, and how that never, in some essences, remains the same, no matter how old you are. And we can imagine if you are suffering with a chronic medical condition, how much more pronounced that relationship will be, and how much more difficult it will be for the parent to step back and say, okay, I'm going to let you handle this. And we've actually looked at what adolescents actually have to say about transition and how their parents respond. And in one study conducted in 2004, in that study, 44% of the adolescents with sickle cell disease stated that transition programs should offer ways to help parents let their adolescents grow up. So when does the process actually begin? Well, we actually know that the process of transition typically begins around 12, which may seem actually awfully young, But it is a process, and it does take some time. But remember, we talked about earlier that we really want to start fostering independence way before that. So we want to start that at maybe between 3 and 5 if we can, and then start focusing a little bit more on the actual process of transitioning around the age of 12. We have, this is actually from the Children's Medical Services. There's a booklet, and I think some of you may have that, called Envisioning My Future. And these are the 3 stages that they propose to go through transition. The first stage they refer to as assuming new responsibilities, and this is primarily for children that are 12 to 14 years old. Now again, remember, we do have some children who do have developmental delays, so for those children, so we could possibly have a 17-year-old who may be 3 or 4 years behind their peers, so they would, of course, also fall in this stage as well once they reach that point. And we want the young person to gradually become an expert in their health condition. So we talked earlier about what epilepsy is. So we want the young adult and adolescent to know what a seizure is, what type of seizures do I have, what medications am I on, what are the implications if I miss a dose, what should I tell people in case I have one. Those are things that really help empower them and really help them to get a good, solid understanding of their medical condition. We also want them to start actively participating in their health care. The next stage is called practicing independence, and this would be for adolescents between 15 and 17 years of age. And here, by this point, we've already been talking to them now for 2 or 3 years about the fact that you're going to be transitioning out of the pediatric health care facility or the children's hospital and going on to an adult hospital. So you should start feeling a little bit more secure and understanding of that. We also want to provide them with time and guidance to practice skills, such as we want them to start making appointments with supervision. You want them to be able to summarize their health history to their healthcare providers. We want them to start asking the doctors more questions and answering more questions. And we also want them to have an opportunity to spend some time alone with the physician. So the parent and the child and the physician can be together, and then at some point let the child spend some time alone where they can talk and just ask questions and just sort of get used to the idea of, I'm going to be seeing the provider without my parent present. Also, they should be involved in decision-making. So when a decision is made, it can be made including the adolescent, the child, the physician, and the parent. We also want to encourage the adolescent to set positive, realistic goals. So we want to make sure that what they're wanting to do is something that they're actually going to be able to do so that we're not really setting them up for disappointment later on. And we want them to have a supportive network of friends and family. We want them to participate in as many things as they can, whether it's sports, whether it's other type of activities through church, just really help them so that they have a sense of support, not only from the parent, but from friends and other family members. So in conclusion, transition essentially involves the development of self-management skills it's normally associated with positive medical outcomes. Key components to transition involve awareness and knowledge of the medical condition, understanding the rationale behind a therapeutic regimen. So the individual or the adolescent, young adult, really needs to understand that you are prescribed this medication and this is what it does. Alternatively, they also need to understand the consequences of choosing to follow a regimen of their own choosing. So, like we heard from Dr. Sheff, what's the consequence of tweaking your medication? What's the consequence of not taking your medication? What's the consequence of getting inadequate rest? What's the consequence of using illicit substances? All those things are things that they need to have an awareness of in their discussions that we need to have, even though they may not always be comfortable, because they can have serious ramifications if we do not.